coronavirus disaster in India is a politically engineered tragedy. That's according to sociology professor Gunvald Nilsen of the University of Pretoria. In an article, Nilsen says COVID-19 in India was mismanaged and manipulated for political gain from the beginning. As of today, India passed 20 million cases and the country's death toll is over 220,000. Professor Nilsen joins me now to talk about his views on the situation in India. Prof, a politically engineered disaster, that's quite strong, isn't it? What leads you to this conclusion?
Well, the evidence is very clear that since the pandemic started in India over a year ago, the Modi government has done very little to address the one imperative that governments must address in this situation, which is to boost the medical infrastructure in order to address the need for care and for treatment that arises with a pandemic. If we go back to the lockdown that was introduced in late March last year, that lockdown did not come with a coordinated effort to scale up India's fledgling public health infrastructure, a health infrastructure that's been underfunded for years. We saw as little as 0.04% of GDP being diverted to immediate health expenditure, and very little of that was transferred to cash-strapped states. So what happened instead was that the government used the lockdown to portray Prime Minister Modi as a man who was capable of decisive action to protect the nation, something that he was effectively not doing, and also to clear the streets of protesters that were out across the nation protesting against anti-Muslim citizenship laws at the time. This has continued since then. We've seen a consistent production by the government propaganda machinery and an uncritical Modi-friendly media basically telling us that India has been handling the situation with great success. It's quite evident today that that is not the case with the kind of case rates and death rates that we're seeing, all of which are likely to be underestimates. And we know that the government was warned about this second wave. There was a parliamentary report in November last year pointing out that a second wave was coming, that there were dire needs for oxygen and for medical supplies across the country. In March, again, the government's own team of medical experts pointed out this risk. And independent medical experts have been saying this all along. Yet the government failed to listen and take action.
So you mentioned the whole issue around the strict lockdown that was imposed initially not being put to good use to get the infrastructure, the health infrastructure ready in India. And you also mentioned the public image of Narendra Modi in the wake of the first wave of COVID-19. But there's another element that you raise, and I think this has been raised a number of times, that the allowing of public gatherings, some of which turned to become, super spreader events. How much of a factor was that? And to what extent should the Modi government be held responsible for that?
Well, the government is squarely responsible for encouraging and promoting super spreader events. The elections in West Bengal were unprecedented in the sense that they were carried out over many phases, more phases than are normal for Indian state elections. The campaigning that took place in advance of those elections was, of course, one which saw several mass rallies with no social distancing, completely COVID inappropriate. And even when all other political parties ceased their campaigning, the BJP, the Prime Minister's party, continued to hold mass rallies. For what we don't know, they lost the elections in West Bengal. So clearly it was worth to them risking the lives of so many Indians to try and win power in this one state. We also saw, of course, that the government allowed the Kumbh Mela, a major Hindu religious festival, to go ahead. And we know now that this has turned out to be a super spreader event. Some of the recent data that I looked at suggests that more than 90% of returnees from this festival have tested positive for COVID.
Yeah.
It's striking also that this event was allowed to take place when we know that last year there was public outcry fed by the government and Modi-friendly media against Islamic groups who met just as the pandemic was breaking out. So the rules are clearly different for the majority community in the country.
Prof, but how are we talking? Look, granted, India is the world's second most populous nation, and therefore the figures were always going to be much higher in terms of the number of people you're talking about. But how is it that we're talking about this situation when India is actually considered the world's pharmacy, in the sense that production of things such as vaccines? We ourselves here in South Africa made a purchase of the AstraZeneca vaccine from the Serum Institute of India a couple of months ago, just giving a sense of the capacity that potentially exists in India. So how do you juxtapose the two? The fact that we call this country the world's pharmacy, but yet it seems even the vaccination program is not really getting up to speed the way it should be.
That's absolutely true. So back in January, two vaccines were approved for use in India. One was the AstraZeneca vaccine. The other one was a vaccine produced by Bharat Biotech, another medical company in the country. Much of the vaccines that were produced were exported as part of a vaccine diplomacy effort on part of the Modi government, which fed into a narrative of India as a rising superpower, no longer dependent on aid from the West and all the rest of it. And then you get a situation where when the vaccination program is expanded domestically, there quite simply isn't enough vaccines available. What should have been done instead is that more producers should have been approved for manufacturing vaccines, and more vaccines should have been approved so that the government could also have purchased internationally in order to vaccinate at the scale you need to. Right now, we're looking at a situation where some 2% of the population have received both doses of the vaccine. And some estimates that I've looked at suggest that it'll take 8.7 years to vaccinate 7% of the Indian population. Now, obviously, that's not going to help much when you have the kind of spread of the coronavirus that you're seeing now. So again, then we're looking at a narrative that has been produced by the government, reproduced both by national and international media about success, when the realities on the ground are very, very different.
All right, thank you for that. That is Professor Alf Nilsen of the University of Pretoria. He specializes in the study of Indian politics, and you can read his views about the situation in India. It's on the Daily Maverick. It's entitled, "India's COVID-19 Disaster is a Politically Engineered Disaster" there. So he was talking to us about his views on that situation.